Hello, everyone, and welcome to our YouTube channel. I hope you enjoy watching my video with Peter Roberts about retinol. And now we're going to talk today about another very interesting topic. And in fact, this condition affects so many adult population across the world. So we will be talking about acne. Peter, thank you for joining me again and taking time to discuss, I think, this probably very precious topic because I don't know how you feel, but I don't think that acne is a cosmetic problem. Personally, I see it as a medical condition. And I would say probably in some cases we can class it as a disease. Would you agree?
Acne is by definition acne vulgaris, which includes it is a medical condition and should actually only be diagnosed by a medic. So beauty therapists are officially not allowed to diagnose acne. Hence, we only work with medical professionals who treat acne. Our medical director is Professor Tony Chu, who is the president of the Acne and Rosacea Society and a 40-year specialist in acne, and worked in London at Imperial College. So yeah, acne is a big area for us, and it's definitely not a cosmetic. If you talk to 100 consultants and ask them what is acne, whether a few spots or a face full of spots, they all sort of have different levels. But true acne is a medical condition, yeah.
You mentioned about few spots or high level of spots of the breakouts. I think we can't also judge everybody the same because for one person, two spots on their face could have an enormous impact on their self-confidence, mental health, performance at home, at work, in personal life when for someone else, acne may have very little impact on their life. So I think we need to look at individual people and we can't judge everyone the same.
Yeah, I mean, there are people who, it's known that people with active acne, if it goes on for a long term, their income is affected. They don't go for the same jobs. They don't interview as well. And it is a fact that interviewers actually subconsciously will exclude acne sufferers from jobs. They discriminate them without knowing about it. So it massively affects a lot of people's lives, their confidence, their ability, even joining the army and stuff. If you've got bad acne, you're still not allowed to join the army.
That is really bad. So I think this type of discrimination definitely should be looked at more closely. And also, what I know from our clinical experience that many patients don't receive the right treatment on national health for acne, or sometimes they've been put on long-term antibiotics, strong medication that have sometimes a lot of side effects, and in some cases simply not effective. So I would like to ask you, Peter, a question as a professional in your field and with your background in product research. What do you think is more effective way of treating acne, topical or prescriptive way? Topical, I mean, where we use still prescriptive skin care product, but we don't take them as a peel, we apply them directly on acne and trying to remodel our skin, or do we need to take tablets alongside with it? We know Roaccutane, one of the most popular prescriptive medication. Could you just give us some opinion on that?
So acne is classified in several ways. There is you develop a hormonal sensitivity at certain phases of your life. It could be time of the month, it could be as a teenager, but it is hormonally driven. But what we don't really want to do is start changing your hormones through your body. Now, if you're taking oral products that can affect your hormonal balance, that can be helpful for the acne, but it can lead to other problems. The other thing is that sensitivity leads to your skin losing lipids and oils, and it thickens up. And that's what leads to the blockages in the hair follicle ducts. So that can lead to congestion. Now, congestion is probably best treated through topical applications, But if you can do something to help to reduce the thickening of the skin so the hair follicle ducts don't get blocked, that can actually help to prevent acne spots developing. But once the skin's thickened and these hair follicle ducts become closed, you get these plugs forming, then the bacteria that was happily feeding on the oil that was coming out of those hair follicle ducts will burrow underneath and start feeding on the oil underneath, and that's where the infection phase happens. Now, the bacteria tend to protect themselves, so quite a lot of topical products struggle to get at the bacteria. So it's then a choice between whether you want to take tablets or whether you want to apply topical. We've done research with our topical products, and we know which topicals work with which oral systemic products. But yeah, ideally you want to do topical if you can, because that means you're targeting the area where the problem is rather than risking upsetting your stomach bacteria, intestinal bacteria, etc. So topical is the safer, but if somebody's got really bad infective acne with deep pockets of infection, then that's when antibiotics are probably considered. You mentioned Roaccutane. Roaccutane, we believe, and I'm saying Professor Chu as well, the acne expert, Roaccutane is overused. It's getting overly used, and it does have quite a lot of side effects, which can change your mood, can make you depressed, it can make you aggressive, it can cause things like splitting and drying of the lips and the armpits. It can have some really deep side effects, and of course you can't get pregnant when you're on Roaccutane. So there are topical versions of Roaccutane, but yes, I just think Roaccutane is overused. It should be kept for when other treatments have not worked as a backup, but it's getting used more and more first line at the moment.
So you mentioned about your topical products. So could you please tell me, what do you think from your skincare range is the best option for treating acne?
Okay, so absolutely. So the infective phase, which is what you saw, the visible phase of acne, which is the spots, the inflammation and the infection, we have a range called OSK, which actually was abbreviated originally for oily skin. So OSK actually slows down the rate of oil production. OSK also has 3 ingredients in it which are not antibiotics, they're not benzoyl peroxide, they're not Roaccutane. Has 3 very good products that actually penetrate into where the infected hair follicle is, and the bacteria actually feed on those ingredients and it kills them. So they sort of kill themselves. So it's very potent at reducing the infection and the inflammation and the oiliness. So that's for the infective phase. You're going to come back in there, Ola.
Would you tell me what the 3 key ingredients are?
So yes, they have these wonderful names called triethyl citrate, ethyl linoleate, and what we call GT oligopeptide 10. Now, the triethyl citrate penetrates into where the bacteria are, and they preferentially break that down instead of breaking your oil down. So by the oil staying in its oil state, that doesn't release inflammatory particles. But by the bacteria breaking down the triethyl citrate, that massively makes the pH more acidic where the bacteria are, and they can't survive in that. The ethyl linoleate releases linoleic acid, and people who become sensitized hormonally, their skin loses linoleic acid levels, the omega oil. So if you can boost linoleic acid levels, they become less sensitive to the hormone, which means that you are helping to prevent the acne happening. And last but not least, the GT oligopeptide 10 also penetrates into the hair follicle where the bacteria are and makes their cell walls more susceptible to the acid. So by making their cell walls weaker, then the triethyl citrate, which is releasing the citric acid, can kill them more effectively. So this works better than antibiotics. We did a clinical study published in the British Journal of Dermatology that shows the OSK formula worked faster and quicker and more effectively than prescription antibiotics.
You know what, Peter? I absolutely would agree with you on that because we use OSK range in our clinic and it has a high success rate. That is probably one of our most popular product because there are so many people who are suffering not just with acne but breakouts, oily, congested skin, and OSK has been absolutely fantastic.
If you,
Now,
I was going to say, if you take the 9 million people with acne, have the whole range of acne, the OSK products will work in around 85% of them. Occasionally, you need to add some help in, and that's where we go back to the retinoids. So, retinols can help the skin to normalize its thickness. And if you open up those blocked hair follicle ducts, then you don't get the infection. So, retinoids would be a thing to add in for the more difficult cases. And Professor Chu would say most good acne regimens will have a retinoid. And last but not least, when you slow down the oil production, the skin can get a bit dry. And in most cases, OSK with the ethyl linoleic can help with that dryness, but occasionally you need to add in something else, and that's where we bring in those ceramide boosters, the CeraBoost. So we call it the triple lock on acne. The OSK products for the infection, the inflammation, and the oil. The retinoids for normalizing skin thickness to open up the hair follicle ducts. And last but not least, if needed, CeraBoost to help manage suppression of oil production.
and that is absolutely beautiful protocols that we're applying in the clinic. It's working fantastically well. Peter, we also know that if acne left untreated, then they lead to another problem, which is acne scarring. So, and there are, ideally, if we can prevent them, that's fantastic. But I wanted to ask your expert opinion. When do you think the acne scarring treatment should start?
Okay, so if you've got active acne, which is fairly widespread, then our view is treat the acne first. If you've got the odd spot, then you can probably go around that. If you do go over an acne spot when you're treating scars, it will not spread the acne to other parts of the face. That's been proven. But in terms of acne scarring, there are various types. There are what's called rolling scars and atrophic acne scars, where the surface is uneven and you've got a bit of depression. Now, they're quite easy to treat relatively, but then you also have scars where you've got literal holes into the skin, known as where you have what's called ice pick scars with little big depressions, deep little tiny holes. But you also have what are called box scars, where the scar is more like a box, and they are much more difficult to treat, and you need to do slightly more involved techniques. But treating them ideally is when you've got the acne under control, rather than when the active acne is there. You can treat acne scars anytime after within 6 weeks normally, and you can get really good results within 2 to 3 months. We don't, as I say, treat scars with active acne.
No, I absolutely would agree on that. But I think my clinical view to that as soon as acne stabilize and under control and you don't have regular active breakouts, the earlier you treat acne scarring, the better result you get. Because with my clinical experience, if we have patients who have had acne scarring for 10, 20 years, they're usually more difficult to treat in comparison to newly developed acne scarring.
Yeah, so the collagen that's been misaligned, creating the gap, becomes more and more fixed over time. So treating it early is always the best. And, scarring can be as big an effect on people's self-confidence as active acne. So sorting it out sooner is always better.
And as we know, for acne scarring, skincare alone probably would not give a desired outcome. It might help with skin quality, but I have never came across where the acne scarring has had a noticeable improvement just using skincare without treatment in clinic. So what is, in your opinion, are the best treatment for acne scarring?
So for some people who just get some surface flattened, reddened scars after the spot's gone, they probably will heal up on their own pretty much. You can help them by improving production of new collagen to replace where the damage to the collagen is. And that would involve retinoids yet again, but also growth factors. So they can help with the superficial scarring with a bit of post-spot damage. But when you've got deeper scars, you really need to stimulate the fibroblast, the cells that make collagen, to really boost the collagen. But before you do that, you also need to get rid of the old collagen, which is now out of shape, and that's leading to the scar. So ideally, you want to stimulate process in the skin to break down the old collagen, and also stimulate the fibroblasts to put new collagen and elastin to replace that. Now, the best way of doing that, you can use lasers, chemical peels, but again, you've got to be careful about causing irritation to the skin, which might trigger excessive redness in lighter skin types or pigmentation in darker skin types. But we have the N-Appeal salicylic acid system, and along with the OSK products, they are medically licensed for treating comedogenic and inflammatory acne. And the N-Appeal SA salicylic acid peels also contain the 3 ingredients that are in the OSK products. So they work very well together. But in terms of scar management, then you tend to want to trigger collagen. You have to get into the lower levels of the skin, the dermal layer, and stimulate the fibroblast. We find the best way of doing that is using our dermal needling pen, the Derma FNS pen. So this is a microneedling pen that put lots of little channels into the skin, which the holes go down to where the fibroblasts are, and they're stimulated. And what we do is we don't put extra energy and inflammation into the upper layers of the skin like you can with deep peels or lasers, etc., because they put heat energy into the skin, which is more likely to give you redness, inflammation, and pigmentation. So we prefer to use the dermal needling devices. If you've got ice pick scars or box scars, then you actually may want to do a bit more. And there's a process, as you know, called TCA cross, which is a chemical revision of skin scars, whereby we put a little bit of a strong acid into the hole or the box, and that stimulates new collagen directly, and it fills up. So you combine the dermal needling with what's called TCA cross. TCA is trichloroacetic acid. So that works very well. I mean, Professor Chu uses that technique in combination with dermal needling. So you numb the skin, you would do your dermal needling to stimulate processes, and then you just do the little TCA cross application immediately afterwards, neutralize that, do it every 6 weeks for maybe 3 or 4 times, and you pretty much will have flat skin.
Yes, it's absolutely fantastic protocol. Well, Peter, thank you once again for such informative explanation of acne management and treatment of acne scarring. It has been a real pleasure speaking with you about this topic. And I hope, guys, you enjoy and found some useful information for yourself from this video.